Hi everybody, Deborah Lavinsky here with Bella Body Pilates in Phoenix, Arizona. And today I am going to wrap up our 8-week series on pre and post pregnancy, exercise, and diastasis recti. Our final little video here is going to be body patience after pregnancy. So if your doctor is telling you that you can go back to exercise after delivery, after 6 weeks, is that good advice? And is that a good idea? So here are a couple of thoughts that we have on that. So first off, there's research that shows that 66% of women with diastasis recti also have had pelvic floor dysfunction. So that means that they have incontinence. So that is something to take into consideration. And another study shows that 31% of women do not have incontinence or are continent after giving birth, but become incontinent sometime in the next 7 years after giving birth. So what is happening in that 7-year time period that is causing incontinence? So what's impacting what we would call this abdominal canister? Your diaphragm, transverse abdominis, your pelvic floor, all of the fascia, all of the muscles, your spine, your lats. What is causing that incontinence to appear? So here are a couple of reasons why we think that 6 weeks is a little too soon. So one is that relaxin hormone that is flooding your body during pregnancy. It's causing those loose ligaments. It makes you really, feel like you're really stretching bigger than ever. Well, that relaxin stays in your body 6 to 12 months after delivery. And if you're breastfeeding, it can stay in your body up to 4 months after you finish nursing. And if you're having babies back to back or right after you wean your baby, you get pregnant again, conceivably you can have relaxin in your body for a couple of years. So your ligaments are going to be looser, so you could be at risk of tears or overstretching ligaments. Another thing to think about is with your fascia, your connective tissue. You've just had this baby inside, everything is stretched out. You may have had tears if you had an episiotomy, whether you tore or you had an incision and stitched, and then even with a C-section. So with a vaginal delivery, you could be just looking at 6 months to 2 years to completely heal, depending on your body, for all of the fascia, the tissue, everything to completely regenerate. And with a C-section, it could be even longer. So those are things that you would need to take into consideration. What type of exercise are you looking to do after you give birth? Now, if you're a hardcore runner and you're going full out running and want to start running marathons again, and that's a lot of impact and jumping, when we're talking about things like incontinence, you might want to rethink that hardcore running. The same would go for somebody who's a CrossFitter. So if you're jumping off boxes and putting a lot of that impact down into the pelvic floor, that would be something else that you would want to be careful about. Heavy lifting, straining, all of that is going to put a lot of pressure. And if you have diastasis recti, it's going to put more force into the area that is already stretched thin. If you've been doing advanced Pilates or go to, say, a mega reformer type classes, you might want to rethink that as well until you get back into a little better shape. So I would look at more of restorative type exercise classes to start off with. And then the fourth is look at your alignment. If you have in your pregnancy been slumping and not paying attention to your alignment, and you're pushing heavy carts, and you're picking up your toddler, and you're twisting, and you're not following what we've talked about with good body alignment and movement, then you need to work on that because you're just going to be repeating poor body mechanics and movement, and it's not going to be helping you with your healing process. So if you're convinced, okay, I want to prevent getting diastasis recti, or I want to heal it, so what would be my next steps? Then one of the things that you want to think about, like 24/7, well, maybe not when you're sleeping, but you want to move and you want to breathe throughout the day in a healthy, efficient, and optimum way. So you want to properly support your body, and you want to work on preventing incontinence, prolapse, diastasis recti, and then for sure herniation. So if you've got any kind of tear, especially if your diastasis recti is 3-4 fingers wider, you just have to be so careful with those body mechanics, that lifting and the straining, so that you don't end up with a bigger problem. So me, your Pilates instructor, I'm more than happy to teach you on how to change your body mechanics and your movement patterns so that you can move in that healthy way all the time. So you hear my little voice in your ear all the time when you're standing in line at the grocery store, like my clients say that they do. So here's a nice little acronym to help you remember some of these terms during your day, and it's the word HEALS. So H stands for hug the belly. So when we go back to our first video, which was hug the baby, you've delivered your baby. So now you can hug the baby. So here's your support of your abdominals and your entire core. So also your gentle hanging. You can use either the Cadillac or your door frame in your house. Next is E, everyday activities. So thinking of your functional movement. A, awareness and action. Hug the baby, using all of this alignment. L, your lateral thoracic breathing. We've talked about that, was in our second video. So breathing from the back, listening to your Pilates instructor, and most importantly, love your body. You just gave birth to a fantastic little baby, a little human being. Your body is just messed up right now. You just grew a baby in there. So give yourself time. Give yourself the gift of healing. Don't be in such a rush to get back and do all that hardcore stuff. Be gentle on your body. It needs time to rest and heal, and especially if you plan to have another baby soon after. So just give yourself the gift of healing. So my name's Deborah Lavinsky. I'm with Bella Body Pilates in Phoenix, Arizona. www.bellabodypilates.com. I have all these videos on my website as well as YouTube. More than happy to have you come in. I can do a rec check, see if you have diastasis recti. We can talk about your situation, how I can help you heal, and I appreciate your time tuning in, and have a wonderful day. Bye.